Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What happens to your blood sugar when you take apple cider vinegar and cinnamon together? Break key takeaways. Break apple cider vinegar and cinnamon might help control blood sugar, but the effects are modest. Too much apple cider vinegar can harm your teeth and digestion, and too much cinnamon can stress the liver. It's important not to replace medical treatments with apple cider vinegar and cinnamon. Apple cider vinegar and cinnamon contain antioxidants and may help lower blood sugar. However, the research is still out on whether they're extra beneficial when combined. They may help regulate blood sugar. Apple cider vinegar and cinnamon have been linked to modest benefits in blood sugar control, according to Keri Gans, Mississippi, RDN, CDN, a dietitian and author of The Small Change Diet. Taken together, there's no solid evidence of amplified benefits, and any effect would likely be modest at best, Gans told Verywell. Apple cider vinegar and cinnamon may also lower cholesterol and increase insulin sensitivity, which is particularly helpful for people with type 2 diabetes. They may protect your heart health. Cinnamon is a good source of antioxidants, and it also has anti-inflammatory compounds, Barron said. Cinnamon may be beneficial for heart health, managing diabetes, and cognitive health. But, like apple cider vinegar, the research is minimal and inconclusive, said Leah Barron, RD, LD, CPT, a dietitian at the Baseline Lifestyle Company. She added that combining apple cider vinegar and cinnamon is not a cure-all. It's important to remember that conditions like diabetes and heart diseases are multifactorial and often a result of a person's overall lifestyle rather than any individual food or ingredient, Barron said. Related stories. Aloe vera juice and apple cider vinegar together could be good for your gut. What happens to your blood sugar when you eat dried fruit? How much should you take? Barron said that in studies where researchers saw improvements in blood sugar and cholesterol, the daily dose of cinnamon ranged from 1 to 6 grams. For apple cider vinegar, the daily dose is 1 to 2 ounces. If you live with chronic health conditions or take medications daily, you'll want to run it by your doctor or pharmacist before trying apple cider vinegar and cinnamon. Apple cider vinegar may interact with medications like insulin or diuretics and can lower potassium if overused, Gans said. Cinnamon, especially in supplement form, can be risky in large amounts. Neither should replace proven approaches for managing cholesterol, blood sugar, or heart health. It's important not to be too heavy-handed when incorporating apple cider vinegar and cinnamon into your diet. There's no standard dose, and more isn't better, Gans said. High amounts of vinegar can harm teeth and digestion, while too much cinnamon can stress the liver. Other risks to consider. Barron said there's no reason you shouldn't have apple cider vinegar and cinnamon together, as long as you're consuming both in moderation and following a few common sense rules. Never eat a spoonful of cinnamon powder alone, as this can be a choking hazard. Always dilute apple cider vinegar with water and drink through a straw to avoid damaging tooth enamel and irritating the esophagus. Do not use apple cider vinegar and cinnamon to replace proven medical treatments. Read more. Prevention and AMP treatment. Diet and nutrition. Greater than 2 sources. Verywell Health uses only high-quality sources, including peer-reviewed studies, to support the facts within our articles. Read our editorial process to learn more about how we fact-check and keep our content accurate, reliable, and trustworthy. Jafarirad S, Elahi MR, Mansoori A, Khanzadeh A, Haghighizadeh MH. The improvement effect of apple cider vinegar as a functional food on anthropometric indices, blood glucose and lipid profile in diabetic patients, a randomized controlled clinical trial.Frontiers in clinical diabetes and healthcare. 2023 4 to 1,288,786. Break Qin B, Panickar KS, Mansoori A. Cinnamon, potential role in the prevention of insulin resistance, metabolic syndrome, and type 2 diabetes.Journal of Diabetes Science and Technology. 2010 43, 685. Break by Maggie O'Neill. O'Neill is a reporter who covers new medical research and addiction. She previously worked at Self Magazine and Health.com, and she was a 2020 fellow at the Association of Healthcare Journalists. Break see Our Editorial Process. Break meet our medical expert board. Break share feedback. Break was this page helpful? Break thanks for your feedback. Break what is your feedback? Helpful report an error other submit, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.